Well, working in HIV is, whether you're a physician or a counselor or a person working in the laboratory, you become an advocate. I learned that very early on. For many, many years, our patients really were unable to advocate for themselves. So many of the physicians or the other healthcare providers, we had to be their voice in trying to advocate for them. Now, luckily now, that's changed. Well, the MacArthur Award is truly an acknowledgement of the work that's been done by the team, the ICAP team at the Mailman School of Public Health at Columbia, as well as the team that I've worked with for 20 years at Harlem Hospital in New York City. And because these teams have been trying very hard to every day think of new ways, innovations, new ideas of solving problems. And I think what's been remarkable is the collective value of all of these innovations. To take the local experience that we gained by working in a community like Harlem through Harlem Hospital programs and take that to global levels. ICAP now works in 14 countries in Africa and is providing services to close to over 500,000 individuals living with HIV. And that growth has been astronomical in such a short period of time. And it's a testament to the commitment and the hard work of the people on the ground, the people we work with in these countries. And it was largely through really working and listening to what the patients were saying that we put together what we call a comprehensive family-focused approach to HIV care, meaning that you don't think about just the person in front of you who has HIV, but you think about who else in their community has HIV, who else in their family has HIV or is affected by HIV, and you mold a very comprehensive program that has a very different perspective from the usual medical model of trying to provide a specific treatment, a pill or a treatment for a disease. One aspect of that is supporting renovations of laboratories, introducing new lab tests. Another aspect is trying to utilize technology. In many of the places where we work, there has never been a computer. There's no way of keeping track of patients. There's no way of having a medical record. There's no way of communicating with all the providers and teaching them and providing them with access to up-to-date new information. So part of our work has been to try to develop systems that are at the level of where the people are working to collect data better, to feed the data back to them in a more efficient way so they can actually utilize it to enhance and improve their work. And a large effort has been to try to utilize technology to provide access to information. In some ways, I believe that the MacArthur Award offers us, all of us, the teams here in New York and the teams overseas, to really think about what are some ideas that we've always wanted to do that could have a high impact, but we never could do.